goal of our session was to discuss medical therapies for patients who have marrow failure disorders. So we had a wide range of speakers talking about immune marrow failure and also inherited, where genetic mutation is causal of the disease.
Yeah, we had a very interesting session, Bhavisha. I thought it was exciting on the topic of medical management of immune-acquired aplastic anemia. One of the highlights was the fact that we have this class of drugs called the thrombopoietin receptor agonists that have been developed for aplastic anemia. And what this class is doing is stimulating the bone marrow to produce more blood, leukocytes, red cells, and platelets. So we had a presentation where a somewhat novel combination for aplastic anemia frontline in immune-acquired severe aplastic anemia using a regimen without ATG, just using cyclosporin and eltrombopag. And the trial here was focused more on those patients who couldn't get ATG or didn't have access to horse ATG, especially couldn't tolerate, or physicians who were at a center that could not administer these therapies, and patients who are not eligible for transplant. And we learned is that about half of the patients actually can benefit from this combination. So this is something that was interesting to learn. So it's an active agent, it's an active combination. And I know, Bhavisha, that at the NIH there's a trial which is looking into starting with this type of therapy with 2 oral drugs, and then give at 3 months, I believe, horse ATG, which was not presented, but I think it's interesting for those who are listening in that there are more to come in this strategy. Now, we also had the presentation of another agent of this class called romiplastin. Now, this was a single agent study in relapsed refractory aplastic anemia. And it was interesting to see that it's an active drug. So it's from the same group, same family, but it's a different drug, but very close in terms of its mechanism of action. And it turned to be very active. So this was actually very interesting. This was data presented in the session. And we've been seeing this data up and coming in recent years. Obviously, the data with eltrombopag is more mature. There's been over 10 years worth of data, and the romiplastin data is more recent, but equally exciting. Also, in the same venue, in terms of this class of drugs, a different type of aplastic anemia, which is not immune, but hereditary or congenital or constitutional aplastic. So this is not the immune system that's causing the destruction of the bone marrow. These are genetic defects that the patients are born with, which eventually leads to aplastic anemia. One of these diseases is called Fanconi anemia, which some of you may have heard of. And there was a trial at the NIH looking at the eltrombopag to stimulate the bone marrow of these patients who become cytopenic, meaning that their counts are dropping. And it turned out to be very effective. That was a very interesting presentation. However, in a different congenital marrow failure disorder called Diamond-Blackfan anemia, not so much. The drug was not as effective. And for this particular disease called DBA, or Diamond-Blackfan anemia, there have been other strategies like that Bhavisha is going to talk about a bit that looks more promising for DBA. And Bhavisha, what were those?
Yeah, so let me start with the Diamond-Blackfan anemia. So these are diseases that don't have a lot of medical therapies that are good. So eltrombopag was the first one to be tried, and unfortunately was not successful. But sort of using the same science and justification, they are now the group at the NHLBI is now studying a new drug called bitopertin. And we're very excited to see what the results of that trial will be, because, as I said, these are the patients who don't have a lot of options outside of bone marrow transplantation.
And that just started, right? The trial just started?
Yes, the trial just started accruing, so I think hopefully by next AMDS meeting we're going to get an update of the results, or maybe even earlier. So going back to immune aplastic anemia, I think there were some new and exciting pathways that are being explored. So at the moment, our immunosuppression backbone is ATG and cyclosporin, as Dr. Scheinberg indicated. But we know that there are certain pathways that are involved, and now targeted therapies could be used. So there are two talks, one using epamellumab, which is a new drug in this space, but it is a drug that's used for other diseases that have similar pathophysiology. And they're just starting, so this was just providing the science as to why they want to study the drug and the trial design. So again, in about 2 years, hopefully we'll have some early data to show us whether or not it is a good drug in this space.
And this strategy is inhibiting what with this drug?
It is the interferon gamma, which is a cytokine that seems to be the mainstay in the immune attack that occurs.
Causing marrow failure.
Causing the marrow failure, exactly. And similarly, there are other class of drugs called JAK inhibitors, and one of which is being tested in immunoaplastic anemia at the NHLBI called ruxolitinib. Early start, and we just know the clinical trial design, but we're very excited to see where this is going to go and how it fits with the current therapeutic landscape that we have.
The preclinical data looks very promising.
Very promising. It looks.
It was published, I believe, last year.
Yes. So the preclinical data Dr. Scheinberg is talking about, this is, we have a well-established mouse model, and in that mouse model of aplastic anemia, ruxolitinib does what it's supposed to do to improve the underlying immune attack.
And this class of drugs have been used in hematology for other disorders.
Yes, other disorders that have similar immune attack.
Like myelofibrosis.
GVHD, which is a specific problem after transplant.
Yeah, so it will be exciting.
Yes, I think we got great updates on the therapies that we already have and how we can improve, and also some new things coming down the pipeline.
Yeah, very exciting, very consolidating data, new data, and futuristic, promising data. I think it was a very well-balanced session, which we hope in the next 2 years, in this meeting, in 2 years, we'll have more mature data of some of the things that were presented, the seeds were presented here. We'll hopefully see that comes to fruition.
And the ultimate goal is to have many more options for our patients and better options for our patients.